What if the forgetfulness you've been brushing off as just getting older is actually a reversible chemical traffic jam in your brain? You walk into a room and suddenly forget why you're there. You lose the thread of a conversation halfway through a sentence. You stare at a familiar face and the name simply won't come to you. And in the quiet, anxious back of your mind, that terrifying question starts to loop. Is this the beginning of dementia? Today, we are looking at a hidden medical phenomenon that perfectly mimics early-stage Alzheimer's disease. But it's not genetics. It's not your lifestyle, and it's not an inevitable cognitive decline. It is a specific, highly common combination of FDA-approved pills sitting in your bathroom cabinet right now. I am Dr. Marcus Vance, and in my practice, I have seen countless seniors quietly surrender their independence to a profound memory fog that they, and sometimes even their doctors, completely misunderstood. They are told it's just a normal part of aging. They are told to expect to slow down. But what I want you to understand today is that for thousands of people, this fog can be lifted. By the end of this video, you will understand exactly why your daily pills might be causing this memory fog, how to spot the chemical mix hiding in plain sight, and the exact steps to safely reverse this burden so you can get your sharp mind back. This isn't about throwing away your medicine in a panic. It is about understanding how different pills interact to create a heavy, invisible blanket over your cognition. Let me tell you about a patient I'll call Arthur. Arthur was a 74-year-old retired machinist from Cleveland, Ohio. As a former machinist, Arthur was a man who lived his entire life in the exact details. He was sharp, methodical, and could rebuild a complex engine from memory. But over the course of about 6 months, a thick, heavy fog rolled into his mind. He started leaving the stove on. He forgot how to use the television remote he had owned for 5 years. During Sunday dinners, he would repeat the exact same stories 3 times, completely unaware he had just told them. Arthur himself told me, "Doc, I feel like I'm trying to walk through deep water. My thoughts are right there, but I just can't reach them." His daughter was heartbroken and terrified. When they sat in my office, she had tears in her eyes, asking me how fast this Alzheimer's was going to progress and if they needed to start looking into memory care facilities. I looked at Arthur. He looked exhausted, frustrated, and genuinely scared of losing his own mind. But before we ordered expensive brain scans or jumped to devastating, life-altering conclusions, I asked them to do one simple thing: empty a brown paper bag onto my desk containing every single pill Arthur took in a 24-hour period. Not just his prescriptions, but everything. The vitamins, the over-the-counter helpers, the occasional pain relievers. As they pulled the bottles out and lined them up, the picture became crystal clear. Arthur didn't have rapid-onset Alzheimer's. Arthur had a chemical traffic jam. He had mild knee pain that flared up in the evenings, so he took an over-the-counter PM sleep aid every night. He had some bladder urgency, so his urologist had prescribed a daily bladder medication. And he had a touch of lingering nerve pain from an old back injury, for which he took an older, very common prescription nerve pill. Individually, these drugs did exactly what they were supposed to do. But together, they were actively erasing his short-term memory. And to understand why, you have to understand the most important chemical in your brain that you have probably never heard of. Inside your brain, there is a vital neurotransmitter called acetylcholine. I want you to think of acetylcholine as your brain's internal Wi-Fi network. It is the crucial messenger chemical that your brain cells use to communicate with one another, to form new memories, to learn new information, and to stay alert and focused. When your internal Wi-Fi signal is strong, your thoughts are crisp. You remember names effortlessly. You process information quickly. You feel sharp. But there is an entire class of medications that are what we call anticholinergic. In plain English, that means they block acetylcholine. They act exactly like signal jammers for your brain's Wi-Fi. When that signal is blocked, the memory of where you put your keys never gets saved to the hard drive. It just evaporates into the fog. Now, a very small amount of this blocking effect is sometimes necessary to calm a twitchy bladder or to help you drift off to sleep. Your brain can usually compensate for a tiny drop in the signal. But here's the tragedy of modern medicine: nobody is adding up the total burden. If you take an anticholinergic pill for sleep, another one for your bladder, and another one for nerve pain, you aren't just lowering the Wi-Fi signal. You are completely unplugging the router. Your brain cells are still healthy. They are still physically intact and trying to communicate, but the signal is jammed. The result? Profound confusion, memory loss, brain fog, and a lethargy that looks and feels exactly like dementia. The American Geriatric Society tracks this closely, and major studies, including landmark research from JAMA Internal Medicine, have shown that a high cumulative anticholinergic burden is one of the most significant, yet highly reversible causes of cognitive impairment in older adults. And this brings me to the very first category of these signal jammers, which is also the most common. It is the one people buy at the pharmacy without a second thought, completely unaware of what it is doing to their memory. I'm talking about over-the-counter sleep aids and nighttime allergy medications. Before we break down exactly what to look for on the label, I want to ask you a quick question. Check your cabinet tonight, or just think about your routine. Let me know in the comments below. Do you rely on any pills with a PM or nighttime label to help you get to sleep? Just leave a quick yes or no. I want to see how common this is among our community today, because what I'm about to show you about those PM pills is the first step to getting your mental clarity back. Let's dive right into that first, most common category of signal jammers. I am talking about the little blue or pink pills you buy in the pharmacy aisle when you have a cold, allergies, or when you just can't fall asleep. The generic name you need to look for is diphenhydramine. You probably know it by its common brand names: Benadryl, Tylenol PM, Advil PM, or Zezquil. Diphenhydramine is an antihistamine. It is highly effective at drying up a runny nose and making you feel drowsy. But the way it makes you drowsy is by crossing the blood-brain barrier and heavily blocking acetylcholine. When you take a PM pain reliever for an achy knee at night, you might sleep, but your brain's internal Wi-Fi is being suppressed for hours. Many seniors wake up the next morning feeling incredibly groggy, physically unsteady, and mentally sluggish. They assume they just didn't get a good night's rest, so the next night they take the PM pill again. The anticholinergic burden begins to build, day after day, turning a mild morning grogginess into a chronic, heavy cognitive fog. Because you don't need a prescription for it, almost everyone assumes it is completely harmless. It is not harmless when your memory is on the line. The second category involves medications prescribed for an incredibly common issue after the age of 60, an overactive bladder. The generic name to watch for here is oxyx-1,2-arsense, oko-arse, oko-arsan oxybutinin, enkersay, arsen, harsen, irse, enkiner, arsen, enpolkarsens, often known by the brand name Ditropan. When your bladder is constantly twitching and making you run to the bathroom, doctors will often prescribe this medication to calm the muscle spasms, and it works. It stops the spasms by, you guessed it, blocking the acetylcholine signals to the bladder muscle. But the medication does not just stay in your bladder. It circulates through your bloodstream, crosses directly into your brain, and blocks the signals there too. Your bladder calms down, but your thoughts slow down with it. You might find yourself struggling to recall recent events or feeling dangerously confused in unfamiliar environments. The third major category involves older nerve, pain, and mood pills, specifically a class known as tricyclic antidepressants. The classic heavyweight in this category is amitriptyline, frequently prescribed under the brand name Elavil. Decades ago, this was a frontline treatment for depression. Today, doctors rarely use it for mood, but they frequently prescribe it at lower doses for diabetic nerve pain, chronic migraines, or stubborn insomnia. Amitriptyline is what geriatricians consider an anticholinergic heavyweight. Its ability to jam your brain's internal Wi-Fi is exceptionally strong. Even at a low dose, for an older adult whose brain chemistry is naturally producing a little less acetylcholine anyway, amitriptyline can dramatically blunt your mental sharpness. Now, before we get to the climax of how these drugs interact, I want to briefly mention that sometimes the chemical traffic jam causing your brain fog isn't an anticholinergic drug at all. Sometimes it is a nutrient blockade caused by a completely different daily pill. I once cared for a woman I'll call Denise. Denise was a 68-year-old retired school teacher from Grand Rapids, Michigan. Denise's husband brought her in because she had started getting lost, driving in her own neighborhood, a terrifying red flag for dementia. But when we reviewed her chart, we noticed she had been taking omeprazole, a proton pump inhibitor, PPI, sold as Prilosec, every single day for 10 years to manage her heartburn. PPIs block stomach acid, which is great for heartburn, but your stomach needs that acid to absorb vitamin B12 from your food. After a decade without adequate acid, Denise had developed a severe, silent vitamin B12 deficiency. Vitamin B12 is essential for maintaining the protective coating around your brain cells and nerves. Without it, your brain literally misfires, creating profound brain fog, confusion, and even neuropathy that perfectly mimics advanced dementia. Once we identified the real culprit, safely adjusted her heartburn management, and gave her B12 injections, Denise's memory fully returned. She wasn't losing her mind to Alzheimer's, she was starving her brain of a vital nutrient. But let's go back to Arthur, our retired machinist from Cleveland, and look at the most dangerous trap of all. We call it the Polypharmacy Trap. Arthur's individual doctors were not bad doctors. The problem is our fragmented healthcare system. The urologist prescribed the oxybutynin for his bladder, the pain specialist prescribed the amitriptyline for his back, and Arthur himself bought the diphenhydramine PM pills at the grocery store for his knees. No single doctor was looking at the whole board. Taking one of these pills is a risk to your memory, but taking 2 or 3? That creates a cumulative anticholinergic burden. It is a simple, devastating math problem. One signal jammer plus a second signal jammer plus a third signal jammer equals a complete cognitive blackout. Arthur was living in a chemical straitjacket that he had built one pill at a time. So, what did we do? We performed a medication burden audit. I coordinated with his primary care doctor and we made a plan. We swapped his over-the-counter PM pill for a gentle routine of melatonin and magnesium. We changed his bladder medication to a newer, slightly more modern class of drugs, like mirabegron, which does not cross the blood-brain barrier. And we carefully, slowly, tapered him off the amitriptyline, replacing it with a targeted nerve therapy that doesn't block acetylcholine. Within 4 weeks, just one single month, Arthur's daughter called my office. She was crying, but these were tears of absolute relief. She told me, "Dr. Vance, I have my dad back. He was telling his old jokes at Sunday dinner. He remembered exactly where he put his keys. The fog is completely gone." Arthur's story is not a miracle. It is biology. When you remove the signal jammers, the Wi-Fi turns back on. This is why you must become the chief executive of your own healthcare. The next time you go to the pharmacy to pick up your refills, I want you to bring your entire list of daily pills, including your over-the-counter vitamins and sleep aids, and ask your pharmacist this exact question. Could any of these medications be contributing to a high anticholinergic burden? Pharmacists are medication experts, and they have software that can instantly calculate this burden for you. Just asking that one specific question could change the entire trajectory of your cognitive health. But identifying the problem is only half the battle. Knowing how to fix it safely is where most people make a critical, potentially dangerous mistake. Let me show you exactly what you must do next, and the one golden rule you can never, ever break when auditing your medicine cabinet. Here is the golden rule of deprescribing, and if you take nothing else away from this video, please let it be this. You must never, ever stop taking a prescribed medication cold turkey on your own. When your brain has been exposed to a daily anticholinergic signal jammer, it physically adapts. Your nervous system tries to compensate for the blockade by creating more receptors. If you suddenly pull the medication away all at once, your brain gets flooded with signals. This can trigger intense rebound insomnia, severe agitation, racing heart rates, or massive bladder spasms. It is a shock to your system that can land you in the emergency room. Instead, the fog must be lifted slowly and systematically. This is a medical process called tapering, and it requires a doctor's supervision. But doctors are busy, and appointments are short. You need to know exactly how to drive this conversation. At your next appointment, I want you to hand your doctor your complete medication list, including every over-the-counter PM pill and allergy medicine you take, and use this exact script. "Doctor, I am concerned about my cognitive health and my total anticholinergic burden. Can we do a medication audit today and see if any of these can be safely tapered down or swapped for safer alternatives?" When you use those specific words, NKT and Candace murder beatings, anticholinergic burden, and medication audit, you are speaking a clinician's language. You are signaling that you are an informed, proactive patient, and you immediately shift the focus of the visit from merely adding new pills to safely removing the ones that are harming you. Now, I know exactly what you might be thinking. "Dr. Vance, if I stop taking my PM pill, I'll never sleep. If I stop my nerve pill, I'll be in agony." I hear this every single day in my practice. But removing a harmful pill does not mean you have to suffer. Medical science has advanced, and we have vastly safer alternatives for seniors today. If you struggle with sleep, instead of reaching for diphenhydramine, talk to your doctor about natural sleep architects like magnesium glycinate or low-dose melatonin. These do not cross the blood-brain barrier to jam your internal Wi-Fi. They simply help cue your body's natural sleep-wake cycle. If you are dealing with an overactive bladder, the older anticholinergic drugs are no longer the only option. Ask your urologist about a newer class of medications called beta-3 agonists, like mirabegron. These target the bladder muscle in a completely different way and have a drastically lower risk of causing brain fog. And if you are taking older tricyclic antidepressants like amitriptyline for nerve pain, there are modern alternatives. Certain topical treatments, localized nerve blocks, or newer classes of nerve medications can manage your discomfort without unplugging your brain's cognitive router. You do not have to choose between living in physical pain and losing your memory. I want to bring us back to Arthur for a moment. When Arthur walked out of my office a month after we audited his medications, he wasn't just walking better. He was standing taller. His eyes were bright, tracking the conversation perfectly. He had his humor back. He had his dignity back. Aging will bring its natural changes. We will all slow down a little bit. We might misplace our reading glasses from time to time. But a profound, heavy, terrifying cognitive fog is not a mandatory part of getting older. Sometimes, the dementia you fear is just a reversible chemical traffic jam. You have the power to clear the road. I want to know what action you are going to take after watching this today. Comment starting today. If you are going to audit your own bathroom cabinet tonight and look for those hidden PM labels. Comment. Asking my doctor. If you are bringing your complete pill list to your very next medical appointment to request an anticholinergic audit. Comment sending this. If you are sharing this video right now with a spouse, a parent, or a friend who manages a daily pill organizer. Taking control of your health starts with having the right information. If this video opened your eyes, please hit the share button and send it to someone you love. It is one of the fastest, most effective ways to protect their independence. Make sure to save this video so you can reference the drug names later, and if you found this helpful, subscribe to the channel for more evidence-based strategies to protect your health as you age. I am Dr. Marcus Vance. Stay sharp, stay informed, and I will see you in the next video.